Take a look at these video clips. You've probably seen some before. Some of these are quite amusing to watch, isn't it? Or this parent destroying his kid's console. Or take a look at this picture of a public subway. Or this picture of people on the streets. Or this, or this, or this. Do you spot something in common? That's right, screens and electronics. All the scenes I just showed you all originate from something which you also probably have, called Internet Addiction Disorder. Now obviously, Internet Addiction Disorder is not just about smashing your things or raging, though it is a major phenomenon, but we'll get into that later. Now, let me explain what is exactly Internet Addiction Disorder. IAD is a term which refers to excessive internet use that interferes with daily life. It is being said that IAD is a habit, a pathology driven by humans' instinct and nature in the pursuit of pleasure and happiness. It was initially introduced by Ivan Goldberg in 1995, who I really cannot find an accurate picture of, so you'll just have to bear with this pixelated face. Now, the real person who focused on the study was actually Dr. Kimberly Young, a renowned American psychologist. To this day, Internet Addiction Disorder is not recognized by the UN or US as a psychological disease, though it is declared a clinical disease by none other than China.
IAD is susceptible at different levels depending on the person's genetics, mental conditions, and overall health conditions. Symptoms and types of IAD varies for different age groups. This is closely related to the usage of different internet and digital equipment regarding lifestyles, roles in society, general interests, and maturity. Say case 1. Jess is a youngster. Because he has a relatively immature mindset, he will be more susceptible to IAD. Moreover, aspects such as mood swings may be more frequent, from poor emotion to control. Then there's person 2, Mike, a typical middle-aged man. Mike might have IAD because of pressure from work and therefore experiences, say, insomnia, one of the most common symptoms of adults. Lastly, person 3, Dylan, a 70-year-old senior. He is more likely to be addicted to watching television, as it is the major electronic which elders use.
To conclude, common symptoms of IAD patients include depression, dishonesty, anxiety, euphoria when using devices, the inability to prioritize, isolation, no sense of time, agitation, mood swings, loneliness, and procrastination. All of these conditions could severely disturb one's daily life. So, unless you want to be a typical lousy person living in their parents' basement, you probably wouldn't want Internet Addiction Disorder to interfere with your life. Here are 2 simple tips which can relieve IAD. Diverting attention from digital device usage. You can consider practicing other interests and socializing face-to-face. Creating schedules to monitor and control your frequency of screen usage and therefore better manage your lifestyle. Other options include individual, group, or family therapy, behavior modification, dialectical therapy, etc. You can access the links posted at the end of the video for further information or check out the second video posted on this channel. No doubt, IAD has silently infiltrated our society, and it really tends to get the better of us. So therefore, it is important to correctly identify IAD and make changes correspondingly. Now, if you'll excuse me, I still have video games to play. Goodbye then.